My name is Patricia Cliff, and in my recently published book, The Art of Selling Real Estate, I've shared the secrets of my 35-plus years selling luxury real estate in New York City. At the same time, my book emphasizes the importance of giving back to the community we live in as real estate professionals. For this reason, my personal mission has been to help alleviate homelessness in our communities. I have also pledged to give a large portion of the proceeds from my book to these causes. Today we will have the pleasure of interviewing Rosanne Haggerty, the president of Community Solutions, a newly established national non-for-profit organization whose mission it is to strengthen communities and to end homelessness. Well, welcome, Rosanne, and thank you very much for giving us the time. I know you're very busy. Rosanne Haggerty is an American housing community development leader who has been engaged in this business of housing the homeless for very many years. Would you care to tell us just how many and how you got started and what your motivation was?
It's been 30 years now, and I started as a volunteer just out of college.
Wow. Working
at a shelter for runaway and homeless kids. And that morphed into working on housing development, and now in Community Solutions working on a much bigger strategy to help communities end homelessness.
And you were a leader in actually renovating housing, weren't you, and adding supportive elements to the housing that you were providing?
Yes, when I had that first volunteer position back in the day, it was so heartbreaking to see that a shelter really didn't solve the problem. We were putting these kids back on the street after about 30 days, and so that made me I think both humble as far as how complicated the problem was, but also fairly certain that nothing else would improve in their lives if they didn't have a stable place to live. So I started then thinking about housing as the kind of the principal vehicle for beginning to help people build up their lives again and actually help the communities they were coming from become more stable.
Well, I think also unless people have a roof over their head, their only focus in life is survival.
Exactly.
And they never move beyond that.
Yeah.
And the increase of housing, of homelessness in this country has been rather shocking. And the solutions have been so splintered from community to community and state to state, and depending upon the kind of funding people could get. Would you care to elaborate a little on that and why you've chosen to do this national program connecting all of these communities?
Sure. Well, you're right, Patricia. I think since 2008 and the foreclosure crisis and the corresponding economic downturn, homelessness has become much more of a reality for more people in the United States, coupled with some other very unusual factors that are frankly unique to our generation. Much larger and growing older population, upwards of 1 million returning veterans. A lot of things converging at a time we've had a very fragile housing economy in many parts of the country. And so what we've been working on at Community Solutions is growing nationally an initiative that we see as a very powerful new way of thinking about this issue, the issue being homelessness, but also the breakdowns in communities that make vulnerable people at risk of homelessness. And it's called the 100,000 Homes Campaign. And the basic idea is that apart from the housing supply or housing affordability, wherever you look, our housing systems are just a mess. If you're in a situation economically, in terms of health, mental health, or other crises, and you aren't able to basically hire a broker, look through Craigslist, but are going to rely on some type of government or philanthropic help, the barriers to finding out the information you need, getting the program support you are eligible for, wending your way through the horrendous bureaucracies that we've constructed around access to publicly supported or philanthropic programs, mean that the people who are needing the help of those programs the most are often completely unable to get through this web of bureaucratic steps. And so our 100,000 Homes campaign has really been principally about helping communities knit what they're doing together into a coherent housing placement system that is responsive to individuals who are in extreme need by name, and getting that whole process of connecting them to housing functioning well. You wouldn't think that this is such a critical piece of the whole puzzle of homelessness, but we found over many years, and now in the 2 years since the campaign was launched, that this insight around how we connect the dots in our communities around vulnerable people can actually lead to far more success than simply building the next set of apartments for people who are homeless. To give you an example of that, in 20 years, I led the first not-for-profit I started. We were able to build about 3,000 affordable apartments, which helped about 4,500 people out of homelessness. But since we've started working in this system improvement way and teaching communities how to actually organize what they do effectively, all of these communities working together have in 2 years housed over 36,000 people.
Amazing.
So there's really good news that some of the solutions are right in front of us, and it's about organizing what we do in a way that people who are in crisis and overwhelmed aren't kind of left spinning in circles.
Right. Well, I think that's how people kind of disintegrate when doors are closed to them because they don't have the right identification, or they don't have the right credentials, or they haven't been hospitalized within a certain period of time. I mean, there are all of these restrictions, and to match the requirements of the shelter or organization that might provide permanent housing with the needs of the individuals is a major challenge. Have you done this through technology, or what has been your main vehicle to try and connect all of the dots?
Right. Technology is definitely a vital part of this effort, but a lot of it is simply relational. We work now with over 180 communities, and what it really requires is identifying a change agent in that community, meaning someone who can convene other critical partners, because homelessness is not going to be solved in our cities and in rural areas unless the housing authorities, the mayor's offices, the not-for-profits, and the VA, and often the public health, mental health system, everybody has to work together. You have to look at reality in the same way. You have to agree on who are the people in the
most vulnerable
state of crisis. And you have to get organized so that people get housed and the support they need in some kind of systematic way. And so what we've done is taught communities how to bring that team together, how to use tools, some of them technology-based, some of them very basic and drawn from public health work, which is about going out and creating a by-name registry of who actually is homeless, and who's been homeless the longest, and whose health is most fragile. And then use technology to help track, okay, where are the apartments available, who has the support services, and to create kind of a housing placement machine, something that, often in the past people haven't thought of the process as being a big part of the problem. And we've, I think, helped to, with all of these communities working together, uncover what's possible if you get the process right.
Well, I know there are across the country many well-meaning organizations, nonprofit organizations, that attempt to take a bite out of this, but they're hampered by the failure of being able to communicate with the other agencies that, so they do house a couple of hundred people. But how many homeless people are there in the United States right now, that as best you can estimate?
Well, HUD has an annual estimate that they publish, which is a roll-up of all of the reported numbers from communities throughout the country. And it's about 1.6 million people, which is shocking. But also when you think of that against our national population, this is a solvable problem. And then also important to know that any day spent homeless is a day too long. There is a there are different levels of homelessness, and what has come to be understood in the last decade or so with better research is that there's a cohort of about maybe 130,000 individuals who've been trapped in homelessness for months and years, and that group is known as the chronic homeless. And our 100,000 Homes campaign, as well as many federal efforts, are now pointed at getting those individuals to the front of the line, people who have been overlooked for many years and who tend to have health problems.
I was going to say their health has deteriorated
That is
massively during that
shocking,
time.
Patricia.
Yeah.
I mean,
yeah.
studies have shown that prolonged homelessness takes an average of 25 years off your life, which are worse odds than most cancers.
Amazing. Well, also, I mean, it also tends to spread diseases. People get tuberculosis. There's nothing sadder than to see somebody ill and old in the streets that can't access or is afraid to access because they don't really feel comfortable they feel paranoid in shelters. And the shelters are really the least desirable place to put people who are homeless. And they're very expensive. I mean, what is the coefficient of the daily rate of housing someone in this transient homeless situation versus in permanent housing?
The exact dollar amount will vary city to city, but proportionately, it's shelter, emergency room care, psychiatric hospitals, jails are all cost a multiple on a daily basis of what it costs to actually help someone afford a stable home of their own. In New York City, I believe it's in the high 40s on a daily basis of per diem cost of a shelter bed, and it's under $30 on average to help someone afford his or her own rent in a stable home. So it's one of these kind of good news, bad news stories. The solution is actually less expensive than the alternatives, but it's about
more
implementing
labor
that
intensive
at scale. It's frankly about deconstructing a whole system that
hasn't functioned.
That hasn't functioned well in a long time, and that has trapped a lot of resources in kind of the wrong place. Your point about the health issues. There are a number of cities who have done studies about who are the high utilizers of the emergency room. Overwhelmingly, it's homeless people who are left in this
pneumonia, frostbite,
totally
all
in
kinds
and out of the
of
hospital. And one day in the hospital could subsidize someone's rent for a month.
Right.
And so these choices really are available to us. They're complicated to work out, moving money from one pot to the next. But if we think of it all as like the big family budget, at the mayor's office level or at the county level, we've got a lot of choices available to us to do things smarter and better for people.
Also, I think that it avoids the NIMBY situation where people are housed together in a shelter and they're suffering and they're put out the next morning and so forth. If you have scatter housing with people who then participate in the community, the community benefits and you don't have these soup kitchens and people that are wandering about looking for their next meal. I mean, it's in a country as prosperous as ours and with the resources that are really at hand. If they're used appropriately, it would seem that this is a solvable problem.
I completely agree, and I think you've highlighted something important, that there is that point at which everyone's interests are aligned. Community members, government agencies, the homeless themselves, and that's in the direction of solutions. Just the stopgap, let's try to manage the problem, measures, shelters.
This winter or in January when it's coldest or something.
They frustrate everyone.
And
I think we've thought, it's too far a reach to go toward real solutions. And I think we're seeing, and I think that's some of the great energy behind the 100,000 Homes campaign. We have all these communities saying, at last, we're getting somewhere. We're actually getting people into housing. We're not, playing this shell game anymore.
Right. Where do you think you've had the biggest success in what part of the country?
I think one way to answer that is just the amazing experience we're seeing all of these groups in all of these cities find themselves part of one community of problem solvers, whether you're in Tulsa or Phoenix or Atlanta. Really, the excitement for us has been seeing that people working on this issue, regardless of where they're living, are forming a new community. There was this amazingly touching, lovely email someone forwarded to me of someone, a woman from Shreveport who'd been active in the campaign there, was on vacation in Santa Fe and saw in some gift shop that she had stopped by a poster about the fact that the campaign was starting in Santa Fe, and asked the woman there. And the both of them ended up in tears about how powerful it was to be working to house their neighbors,
Right.
and that they felt part of one community despite Shreveport and Santa Fe.
Right,
And so
right.
that's really, at the end of the day, what we need in this country, I think, a sense of our ability to solve complex problems with our neighbors. And I'm so proud of the fact that communities are creating that experience for themselves, and that we have a part to play in that.
Well, it's important also, since we're also tethered to technology, to have the touchy-feely aspect of people actually coming together eyeball to eyeball and engaging with each other to solve these problems, because then, you know, new ideas are born and things are shared. How would you say, I mean, a lot of my colleagues are very busy, but they're also close to this subject. How would you suggest that the average working person who's concerned get involved and help your work and the work of reducing homelessness?
Well, because the nature of the campaign is national in scope, pretty much wherever you live, you can plug in, you can go on our website, which is 100khomes.org, and see who the local contact person is for the campaign in your community. And so this is, its power is in its localization as well as its, you know, kind of universal, you know, connections. But say you're living in Philadelphia and you want to see how you can help, there is a lead contact in Philadelphia.
Oh, that's
who
terrific.
can tell you where your help would be needed. And I think, to your earlier point, this notion of, can you help equip a home for someone who's just moving off the street? Can you be helpful with even, you know, some level of community support, or you know, facilitate some assistance with a job? All of these things that people need once they're housed. But the campaign is really a web of local campaigns. And then at the national level, as we think how do we help communities become more and more effective at this, we want very much to create sort of a council or some way of capturing the input of landlords. We feel that the country's landlords have sort of been left out of the equation of homelessness. That we think of maybe housing authorities, but you know, that it's all about, you know, the social service agencies and where the money for subsidies comes from. And we found through the campaign that there are, you know, most housing, of course, is owned in the private sector. There are plenty of landlords who wish they had better options when a tenant is falling behind in rent to help prevent homelessness. I think there are many landlords, based on our conversations, who would be willing to take a chance on someone who's had an experience of homelessness or has had difficulty with their housing in the past, but they want some support in taking that risk. And if it's a connection with a local social service agency who can help problem solve, or, you know, local government
a sponsor,
who can help.
sort of a local sponsor, or even Section 8.
Precisely.
Yeah, I mean, the enormous number of people, children coming off out of foster care at 18, and people coming out of incarceration who aren't really heavy-duty criminals, you know, who need a future. They need people to build their future and provide them, first and foremost, with a roof over their heads so that they can use that as a starting point. So I think that what you're engaged in is really noble and creative, and we wish you really the best of luck. And I hope that all of my colleagues in the real estate industry, be they landlords or agents or whatever, will give their best efforts to helping in one way or another, so that we can all move your objectives forward. And thank you for your time.
Thank you, Patricia.